My name is Abigail, and my speech is going to be over pediatric nursing. Everyone at some point has gone to the ER. If someone went as a child, they were most likely scared. But the first person they meet is a nice nurse who helps ease them through the pain and gets them through the visit. This nurse changes a very terrifying experience to something that they know they can get through. I plan to be a pediatric nurse so I can help kids and help them back to good health. I also want to help them get through a very scary situation. Nursing is a very well-known field, but there is much schooling and training that you have to go through, but the overall outcome is very well worth it. When becoming a nurse, you have to find out what type of schooling is needed and what the job will consist of. I will inform you of both of these things and why I want to be a pediatric nurse. To be successful in life, we have to know what we are doing. That is why, when you want to be a nurse, there are so many years of college you have to go through. To be a nurse, it requires a minimum of 4 years to get your BSN, plus the years it will take you to become a registered nurse and the years of experience you need to become a pediatric nurse. To be a nurse, you have to have a bachelor's degree of science in nursing, which usually takes about 4 years. Then you have to get an RN and get several years of experience in the nursing field. Then take the Certified Pediatric Nurse Examination, which will make you a pediatric nurse. You also have to take certain classes to get a BSN, which is a bachelor's degree of science in nursing, and certain fellowships and programs to become an RN. There are complete extensive classroom work as well as plenty hands-on clinical practices to get your BSN, but it also includes the basics that you need to take in college. Once you get your BSN, you start your RN, you work on fellowships and go through training. There are many responsibilities to becoming a pediatric nurse. This includes helping and diagnosing small things that are wrong with sick children and the normal responsibilities that many nurses have. They perform vitals, examinations, and taking care of the minor injuries that kids may have, and educate the parents on procedures or regarding their children's health. A regular nurse has the responsibilities of managing IV lines, providing emotional support to patients and their families, and communicating with doctors. And a pediatric nurse has to do all of those things. There are multiple reasons why I want to become a nurse. Not just a regular nurse, a pediatric nurse. And it's not just about helping people. One reason is that my little cousin, who was 1 at the time, was diagnosed with leukemia and had great nurses. They cared for him and tried their very best to make the best out of an awful situation. They also made his family very informed with everything that gave them the best advice on how to get through this process. I also want to become a pediatric nurse to help children who can't always tell everyone what is hurting and what is going on with them. That is why and how I will become a pediatric nurse and what pediatric nurses actually do. If anyone is interested in going to pediatric nursing, they should know that it's a lot of schooling, but helping children is always worth it.